Hi everyone, welcome to my channel and thank you for watching this video. Kindly subscribe if you have not subscribed. In this video I'll be talking about 40 mistakes made, 40 common mistakes made during APIE. If you're nurse and you're preparing for your Nmc Osce, make sure you avoid any of this mistake I'll be listening. If you want to clear your Nmc Osce once, make sure you avoid this mistake. You know, NMC, they can be very critical and very picky. A little thing can just make a candidate fail the Nmc Osce. So the first mistake is not checking for safety before approach. Most of the videos, the first thing you have to do first thing first, check your scene, check that the scene is safe to approach. Second mistake is not using alcohol gel on approach. When you don't use an alcohol gel on approach, the rule is before you approach a patient, sanitize your hand. Sanitize your hand after touching, before touching, after you touch a fluid. Or the third mistake is forgetting to put the date and time on news chart. When you forget to put the date and time on a new chart, automatically fail. That is it. Now, the fourth mistake I'll be talking here is miscalculating the news charts. Okay, I'm going to be doing a video on a news chart, and you know, this is a sample of a news chart. And on a news chart, there's a calculation that is done. This is different calculations are done. There are some calculations you have to do, and you're going to know the total news score. If the score is 1 to 4 or 3, 4, 5, 6, 7, when you have 3 in a single parameter, there are some indications for the news score. So if you did not calculate your news score properly, instead of you getting a 3 as a total, you calculated 4 or you calculated 2, automatically that is a fail in assessment. So it's one of a common mistake that is made by nurses in the assessment stage. Now, the fifth mistake is forgetting to put down the patient is on oxygen therapy on the news chart. You know, on the news chart again, there's a point where you see the SpO2 scale. There's a scale 1, SpO2 scale 1, and there's a SpO2 scale 2, and there is a point of here where if the patient is not on oxygen, there is a point where you're going to input it as here. If the patient is on oxygen, you have to ask the examiner how many liters of oxygen is the patient, so you have to indicate it on the chart. If you do not indicate it on the chart, that's a fail in Osce. The sixth point is if a patient scores 3 or more in one of the observation categories and not putting them down on hourly obs. In news, when you use a news chart, especially if you're getting a scenario that if the patient is in a hospital setting, it's going to be a news chart. But if it is in a community setting, the chart you're going to be seeing in assessment is quite different from this. It's not going to be a news chart. But in a common and for news, in the score you get in news will determine the escalation plan that will be done. When you have a score of 0, the minimum observation time is 12 hours. That's you do the observation of the patient every 12 hours. But when you have a total of 1 to 4, you do the observation between 4 to 6 hours. Every 4 to 6 hours, that's between 4 to 6 hourly. If you have 3 in one single parameter, you have to put the patient on hourly observation. Now, the common mistake people make is when you have a patient with 3 in one parameter and you do not put the patient on hourly observation. That is a fail in Osce. Yeah, not asking for allergies. That's the seventh mistake, is not asking for allergies in assessment and implementation. One of the routine questions you should ask in assessment and implementation is, do you have any allergy? Ask the patient, do you have any allergy to food, latex, or medication? Most time the patient will answer you we answer the type of allergy they have. Oh yes, I'm allergic to penicillin, I'm allergic to latex, I'm allergic to this. They'll tell you, and you ask, what type of reaction do you present with your allergy? So this is a common mistake if you don't ask that. Now the 8th mistake is not leaving the patient with a call bell in assessment and implementation, especially when you have a patient in a hospital setting, when you have a scenario of a patient in a hospital. Make sure you leave the patient with a call bell after your assessment and implementation phase. The 9th mistake is not getting consent for observations. Just have it at the back of your mind that before you perform any procedure on a patient, make sure you ask for consent. That is very, very important. That is one of the practices I had to learn here. Before you do anything, make sure you ask for consent. Are you happy for me to proceed with this procedure? Edward, I'm here to perform your routine observation. Edward, I'm here to give you your due medications. Make sure you ask for consent in anything you want to do. The 10th mistake is not sharing the plan with the patient on what happens next. You know, and this might not really be a fail, but it's just a mistake. I'm not saying all what I'm saying is not like it's going to automatically fail you, but if you can just try and avoid this during your OSCE, it will be a very good thing. You know, make sure you share the plan of patient. Make sure you share the plan to a patient and always tell them what is going to happen next, and always tell them what is happening. Don't just leave them aloof. You know, most of them knows what is happening. Most of them know what is really happening to them. So you have to carry them along with what you are doing. And that is why you have to explain the procedure to the patient. Before you perform any procedure, make sure you explain everything. In implementation, after giving your medication, make sure you tell the patient, oh, I will be back in the next 30 minutes to check for the effects or side effects of the medication I've given to you. The 11th mistake is not making the plan personalized. This is in planning now. Not making your planning personalized. As for example, in a planning stage, there's a point to write, nurses will monitor John's new score hourly. It should be the nurse will monitor Ruth's new score hourly, not just saying Ruth will be monitored by who? Who will monitor Ruth? It should be the nurse. So the nurse will, the nurse will do. This is very important. 12th mistake, not writing down a review date and time for the planning. In planning, you're going to see there's a column that comes in. It's going, even before starting the planning section, there will be 1 minute period. So make sure you read it properly. Check the time. Most time it's going to say, assume it is today, and the time is, they're going to put the date, assume the time is 1600 or the time is 200. Make sure you follow that time given to you. Don't look at your time and say, okay, oh, on my own time it is, on my breast search it is 1200, but my OSCE paper is giving me 1600. I'm going to follow my time. No, follow the time given to you on your OSCE sheet, and it's going to tell you the date. Assume the date is today. You should write the dates you are doing your OSCE exam. Don't go and write assume the dates today in the plan. It's good. So about the date and time, make sure you follow the dates given to you on your planning planning paperwork and the dates you're writing the OSCE exam. Now the 12th mistake is not writing down a review date and time for the planning. Okay, after that, 13th, not signing and dating the planning. At the end of each planning, make sure you print your name and sign. Most times, what was even advised to us during when I was practicing OSCE, he said, even when you get your planning paper, the first thing you should do is just write your name and time and signature, because you might not have time to, you know, a lot of people had made that mistake that after finishing their planning, they did not remember to sign and date it. So if you do not sign and date it, definitely that is a fail in planning. So make sure you date it and you print your name. You don't just sign, you have to print your full name in planning. 14, not prioritizing the planning needs. Make sure you prioritize your nursing problems. This is very important. 15, not checking the patient's ID wristband for implementation charts. You know, these mistakes failed someone that I specifically know. When a patient is when you have a scenario of a patient in a hospital setting, make sure you check the ID band. You just say, excuse me, please, can I check your ID band? Cross-check the ID band with the documentation, with your implementation charts you have. Make sure you cross-check it with the ID and make sure it corresponds. That is the full identity of the patient. You can tell the patient, ask the patient the full name, date of birth, and make sure you cross-check it with your implementation charts. The 16, not verbalizing expiry dates on the medicine pot. This is an implementation mistake. When you are before you dispense your medication, you have to raise up the medication bottle and read it out to the examiner. Make sure the examiner hears what you're saying, and tell the examiner this is paracetamol 500 milligram, and the expiry date is 2010 to 2023 or 2023, and the prescribed dose is 1000 milligram, and I can see 500 milligram on the bottle, so I'm going to be giving 2 tablets. So make sure you verbalize the expiry date. Mistake 17, misreading a non-administration code and interpreting it as drug given to patients. Mistake 18, not asking whether the patient has eaten today. Sometimes the patient might be on meal per hour, so make sure you ask the patient, when last did you have your meal, before dispensing any medication. Especially for medication like NSAIDs, you have to ask the patient when last he had his meal. Make sure you ask, because there are some medication you can decide not to give ibuprofen if the patient says, I have not eaten today. You can just code it and say, I'm not happy to give you this medication now because you have not taken your breakfast today, and I would just code it. When you take your breakfast, I will come back and give it to you. You can do that in Osce, so far you code it and they know you are not happy giving that. So make sure you ask, depends on the type of medication, but just do that to all medication. The 19th mistake is double dosing the patient by misreading start dose given and then administering the regular medication too. You know, on the implementation chart, the first page, you're going to see a place where the start doses have been given, and the next page you'll see the regular doses, the antibiotics, and all that. So a lot of nurses, they just overlook the start doses that was given, and that same medication comes up again on the regular medication, and probably it's just 2 hours interval. You know, when you give that again on the regular medication, you've already overdosed the patient, so that is a fail. So it is assumed that the patient was given an overdose. So make sure you check the start doses, the medication that was given on the start doses, before giving your regular doses. So if a medication comes up again on the regular doses that has been given on the start doses, you have to code it that start dose given. You can watch my implementation video. I listed the codes in the implementation video, so yeah, you will know the appropriate codes to use for medication. Mistake 20, mistaking a confused patient for an orientated one on GCS 14/15 or 15/15. You know, this comes up in assessments. In a situation where you have to do a neuro observation, you're going to do a full glycoscoma scale. You have to assess the patient, check the patient's orientation to time, place, and person. You can ask the patient, do you know who is talking to you? Am I a nurse? If you say, oh, it is a nurse, okay, fine, the patient is oriented. Okay, you can also ask, can you tell me what time of the day it is today? or can you tell me what the day it is today? That's when you know the patient is orientated or person. Now also ask the patient to lift his legs, lift his arm, can you squeeze my hands, so you can check for the power in the lower limbs and the upper limbs. Check to see if the patients are full power in the lower limbs and the upper limbs. Mistake 21, not explaining the pain score to the patient before asking them to score the pain. Now this pain score is also a routine question to be asked in either assessment or implementation. When you approach a patient, before ask the patient, do you have any pain now? Patient might say no, or patient might say yes. Okay, now you have to score the pain using a pain rating scale. Ask the patient on a scale of 0 to 10, where 0 being no pain and 10 being the worst pain. Can you tell me, can you score your pain for me? Now the patient is going to give you an appropriate pain score. When you know this pain score, it's going to help you in your planning and it's going to help you in your implementation. So make sure you always ask for the pain score of the patient. Question mistake 22 that is always made is not suggesting possible referrals. In a situation where a patient had a fall in assessments, you would have checked the scenario that was given to you. Make sure you refer the patient, or the patient is a diabetic patient. Suggest referral. Oh, okay. Just tell the patient, are you happy if I suggest a referral to the physiotherapist or the multidisciplinary team or the dietitian? Make sure you suggest referral when you're assessing the patient. Administering a medication that they are allergic to. Oh, this is a complete fail in Osce. When you administer a medication that the patient is allergic to, okay, for example, most patients are always allergic to penicillin, and the patient is allergic to penicillin, fine, and in the medication chart you discover that the patient is due for amoxicillin at that time, and probably 1600, and amoxicillin is due for 1600. Don't even dare to give amoxicillin, because it is a family of penicillin. Patient is allergic to it, so you have to code it. Don't give any. Make sure you check the medication the patient is allergic to. When the patient is allergic to that, don't give the medication, even if it is due, even if it is an antibiotic. So far the patient is allergic to it. That is why you have to be conversant with your medication. Also, you have to know the indication of medication, you have to know your side effects. The next mistake is misreading when a drug is due to commence tomorrow and then dispersing it today. I talked about this in implementation. Make sure you read your implementation chart from the beginning to the end. Make sure you read it. There are some medication that they're going to write start dates tomorrow. Some they'll write start dates today. Any medication that is start date tomorrow, and it is even the time you're administering the medication, don't give that medication, because the start date is tomorrow and not today. So make sure you make sure you read the date the medication is to commence and the date it's supposed to end. Make sure you read that. Also, mistake 25. We on 25. We have 40 to go. Okay, now mistake 25 is not checking an IV cannula site. When a patient is on IV, make sure you check the line. You check for phlebitis. Is the line, is it red? Is it painful? Is it swelling? Check the site of the cannula. Check how the cannula is. You have to assess, you have to score that. So make sure you check the cannula sites. It's part of your assessment. That is done during assessment stage. Now, mistake 26, not verbalizing caution over medication. But I mentioned this also in my implementation video. Make sure you ask, when you are to give a medication like an antihypertensive, ask the examiner, please, examiner, can you tell me the last blood pressure of the patient? Or you can even ask the patient, can you tell me what your last blood pressure is? The examiner will answer you. but you will face the patient, but the examiner will answer you. So just assume, ask anything possible. There is no silly asking. I think you should just ask everything possible. So in case you want to give the Joxin, you know you have to what? Ask for the pulse. Yeah. So the 27th mistake, not writing down all medication administered to the patients. When you administer 3 medication or you administer 2 medication and you just write 1, that is documentation error, and that is a fail in Osce. So make sure you document appropriately. That is really important. 28th mistake, not writing down the non-administration code and the reason on the back of the implementation. When you code a medication, when you code, that means you did not administer the medication. So make sure you write the reason. Probably code 9 other reasons. Patient is allergic to penicillin, and amoxicillin is a family of penicillin, or patient is nail by aura, or the patient not on what. You're going to see, you know, the implementation. You don't need to cram this. You don't need to cram it. You're going to see the code. So just make sure you code and write the reason, not just write code 9 or code 10 or code 6 or code 5. Make sure you write the reason for coding this medication. The 29th mistake is not verbalizing after taking the pulse for 1 minute. Respirations are counted for 1 minute, and also after this mistake comes up in assessment phase. Make sure you tell the examiner, tell the patient, oh, I'm sorry, I took your respiration for 1 full minute and your pulse for 1 full minute. I did not tell you before commencing because I don't want it to alter your reading. 30. Forgetting a full hand wash after greeting the patient in assessment. Though in some Osce centers you might not see a full hand wash, but make sure you use the alcohol gel. The alcohol gel is always available. Make sure you use it continuously, especially when you are doing the aseptic non-touch technique, that's the ANTT. In fact, if possible, just continue sanitizing your hand, because sanitization of the hand is very, very important. So make sure you continually sanitize your hand. Don't forget. 31. Forgetting to sign for a medication implementation. Don't even try to forget signing medication given. So because anything that you do not document is assumed that it is not done. So no documentation is equal to failure. So 32nd mistake, 32 now, forgetting to put a date and time of the discharge letter in evaluation. Now we are in evaluation now. When you forget to put a date or a time of evaluation, that is like a fail. This is how the paperwork of evaluation looks like. Now you're going to see something like assume it is today and the time is 1800. When you see that assume it is today and the time is 1800, this is how an evaluation here looks like. Make sure you put the dates. That assume it is today. Yeah, it is today you are doing your ski. Assume the dates, it is that day, and the time that is there, assume probably 1600 or 1700. Put that time. Make sure you put that time in during evaluation. Now the 33rd mistake is not verbalizing how many tablets are needed for the dose. Make sure you verbalize. Okay, I'm going to be giving 3 tablets. I'm going to be giving 2 tablets of this medication, and when you pour in the medicine pot, make sure it doesn't touch the medicine pot. Just try and drop it inside the medicine pot when you're trying to administer your medication. And when you finish administering your medication, just leave it there. The examiner is going to count it, so you don't need to cover it or anything. Just leave it. Now 34th, not touching the patient before using alcohol gel. Not reading the scenario or instruction correctly. You know, during this 5 minutes pre-reading assessment and 1 minute pre-reading implementation and planning, 1 minute pre-reading evaluation, make sure you use that 1 minute judiciously. just try and be calm and make sure you read all instructions before commencing. This is very important so that it doesn't mix any instruction. Make sure you read it. Now, not having a clear and legible handwriting. This is important in evaluation and planning, because evaluation and planning is a silent section. You have to have legible handwriting. If not, you won't be able to scale through that. So make sure your writing is very legible. Now, the 37th mistake: not communicating with the mannequin effectively, not demonstrating effective caring. That's the 6 C's now, which is caring, compassion, communication, commitment, courage, and competence. Make sure you demonstrate your 6C. This is very important. Now, 39th mistake: not fully mentioning when you repeat the observation for GCS in planning. That in planning, when you have a neuro condition, make sure you indicate when you are going to do your next neuro observation. Okay, the observation is going to be done in the next 30 minutes, or in the next, I would reevaluate the patient in the next 30 minutes, every 30 minutes, or when the clinical condition changes. Make sure you give a specific time when you are going to reevaluate the patient. Okay, and the last 40, the final mistake: this time, make sure not completing your station in time. A lot of time you'll be, the stopwatch will be at a place where you can see it. Most time the stopwatch is always positioned strategically. So make sure as you are doing your procedure, use the side of your eye to look at the stopwatch. Make sure you look at the stopwatch and you say, oh, I have just 2 minutes left, I have to rush up this. I have just 3 minutes left, I have to. Make sure you watch your time. Don't be too slow on checking things. And when you discover that your time is almost off and you've not really done everything, just start verbalizing everything you're supposed to do. Oh, in normal clinical setting, I'm going to do this. In normal clinical setting, I'm going to do that. In normal, make sure you verbalize all you are supposed to do. If you are not able to meet up with the time, make sure you meet up with your time. Most of the stations are 15 minutes. Some skills you're going to use 12 minutes. So make sure this is part of the instruction you have to read in before you start your OSCE. So thank you for watching this video. This is the end of this video. I hope you enjoyed this video. Share this video with your friends preparing for OSCE, because when I was planning to do my OSCE, I kept on watching a lot of things and I know it helped me. I know this video is going to help a lot of you preparing for OSCE, and I wish you a successful journey in becoming a UK RN. And thank you for watching this video. Kindly subscribe to my YouTube channel if you learned one thing or the other. And guess what? I'm going to be seeing you in my next video. Thank you for watching. See you guys all later.